For years they've had stories about certain foods and substances which act as aphrodisiacs, meaning that it increases sex drive or libido. Some of these things are actually just ridiculous and have had sad consequences, such as the harvesting of rhinoceros horns, which were long thought to provide aphrodisiac effects, various animal parts. It's led to the near extinction of various species. And the really sick part about it is none of these things actually work as aphrodisiacs. It's all just folklore, and nonsensical folklore at that. However, there are certain foods or supplements which may actually, according to some research, might actually increase libido or sex drive. Now, it's an interesting thing here is that some of these substances can increase sexual desire or libido, but not necessarily increase testosterone, which is kind of interesting from a scientific point of view because of the fact that testosterone is the libido hormone. In other words, testosterone is basically what controls sexual desire in both sexes, men and women. Not estrogen, testosterone. Testosterone causes or stimulates sexual desire in both sexes. There's a couple of myths involved I can't get into in this video, but suffice to say that a lot of people talk about estrogen stimulating sexual drive in men. It does not. It does not stimulate sexual drive in men. Another common myth is that dihydrotestosterone, which is a byproduct of testosterone metabolism, also is needed for the development of male erections, and also is involved in sexual desire. Both false. It does so in certain animals. It does not do that in humans. In humans, it always goes back to testosterone. I should also point out that just so you understand, drugs that are used to treat, let's say, sexual erectile dysfunction problems, such as Viagra and Cialis, these things are what they call phosphodiesterase 5 inhibitors, I believe it is. They work basically by increasing something called cyclic GMP in the erectile tissues. To make a long story short, they basically increase nitric oxide locally in the penis, and as a consequence, it allows a person or a man who's experiencing erectile dysfunction, because nitric oxide dilates the blood vessels. It allows a man who normally might have problems with sexual erections to achieve an erection, because it overcomes the blockage of blood vessels that can occur for various reasons: diseases, diabetes, heart disease, atherosclerosis, the Viagra. But an important point, the reason I'm mentioning this is there's a mistaken idea that drugs like Viagra and Cialis increase sexual drive or desire. They do not. All they do is increase the blood flow within the sexual organs. They do not increase sexual desire. Do not. I'm going to have more about the effects of drugs like Viagra on exercise and actual muscle gains. There's some interesting research. I'm going to have an article upcoming in my Applied Metabolics newsletter about that, including the idea that some bodybuilders take Viagra before training because they say it gives them a much greater pump. Now, there's some truth to that because, as I said, Viagra, without question, increases nitric oxide. However, I mean, seriously, I would not experiment with that in the gym. I mean, I would not take Viagra and go to the gym because you might get a pump in an area where you might not want it. If you follow my gist, and it could be embarrassing, you know what I'm saying? So, anyway, but I'll talk about that more in the article. But right now, I want to talk about some foods and supplements that, again, according to some science studies, some of these animal studies, some of these human studies, may actually increase libido or sex drive. One of them is a popular supplement called Tribulus terrestris. Tribulus is a small leafy plant and whose roots and fruit are popular in traditional Chinese and Ayurvedic or Indian medicine. Now, it's very popular in bodybuilding as a sports supplement because it's touted to increase testosterone levels. Now, how that started was Tribulus was given some early studies published in Bulgaria showed that giving Tribulus to men who had erectile dysfunction seemed to improve the condition, and because of the association with testosterone and also erectile function, they assumed that Tribulus increased testosterone. They even came up with a mechanism, supposedly elements in Tribulus called saponins, which are soap-like chemicals that can somehow stimulate luteinizing hormone, which is a pituitary hormone that controls the synthesis of testosterone in the body. That was the supposed mechanism for how Tribulus increases testosterone. However, in studies of humans, not done in Bulgaria, done here in the West with athletes, bodybuilders, Tribulus has never been shown to effectively increase testosterone. However, this is kind of pathetic. It does seem to increase estrogen, which is just the opposite of what anyone using Tribulus would want. There is one study that showed that it increases insulin-like growth factor 1, which is an anabolic hormone. So Tribulus might have a slight anabolic effect after all, but it's not really good for improving testosterone. On the other hand, there is some evidence that it actually does increase sexual drive. And for example, in a 2014 90-day study of women who reported low sexual pleasure, taking 250 milligrams of Tribulus terrestris 3 times a day increased sexual satisfaction in 88% of the female subjects. Now, what happened in the study was levels of DHEA, dehydroepiandrosterone, an adrenal steroid, which can convert into either testosterone or estrogen. It increased in the women. But strangely enough, this is what I find strange about this study. While levels of DHEA increased in the women, levels of total and free testosterone declined. Now, normally that would equal a lower sex drive. So it's kind of mysterious how, why the DHEA would increase the women's sex drive after using Tribulus. Never was explained. Another 2016 two-month study in men showed that taking 750 to 1,500 milligrams of Tribulus improved sexual desire in 79% of the men. However, studies with men with erectile dysfunction show mixed results. One study found that taking 800 milligrams of Tribulus daily for a month did not treat erectile dysfunction. However, another study of 180 males ages between 18 and 65 with mild or moderate erectile dysfunction, taking 1,500 milligrams of Tribulus daily for 90 days improved erections as well as sexual desire. So, sum it all up, the Tribulus seems to have a possible effect in helping erectile dysfunction, but it does seem to see increased sexual desire, but not testosterone. Another popular herb that's always frequently associated with testosterone and erectile dysfunction treatment is Maca, known as Libido mayonnaise. It's a root vegetable traditionally used to enhance fertility and sex drive. It comes in various forms: powders, capsules, liquid extracts. A 12-week study published in 2002 found that 42% of the men who took between 1,500 and 3,000 milligrams of Maca daily experienced an increased sex drive, but again, no increase in testosterone, which is interesting because you often find Maca included in so-called testosterone-boosting supplements. I think the reason they put Maca in there, not because it increases testosterone, but rather it does seem to increase sexual desire. And since sexual desire is kind of associated with increased testosterone, somebody taking a supplement that has Maca will think that their testosterone went up because the sexual desire went up. But one thing doesn't have much to do with the other. A 2010 review of 4 studies in 131 people taking Maca consistently for at least 6 weeks improved sexual desire. It also helped treat mild erectile dysfunction in the men. Some evidence suggests that Maca may combat the loss in libido that occurs as a side effect of antidepressant drugs. This involved a 12-week study of 45 women. Some of them were divided into a group that took Maca, the other group took a placebo. These women used antidepressant drugs, and they, as I said, the women who took Maca ingested 3 grams of Maca dry root a day, while other women injected a placebo. Uh, uh, and most studies found, and what happened was, at the end of the study, the women who took the Maca showed a great increase in sexual desire compared to the women who didn't take the Maca. Now, how much Maca do you want to take a day? Well, the studies show that as far as increasing sexual desire, the range would be 1.5 to 3.5 grams a day, taken daily for 2 to 12 weeks. That's about the right amount to increase libido. Another herb that's associated with sexual libido is red ginseng. Uh, a 2010 20-week study in 32 menopausal women that was published in the Journal of Sexual Medicine found that taking 3 grams of red ginseng a day significantly improved sexual desire and function compared to a placebo. Now, in addition, one of the reasons why red ginseng can help is because it seems to boost the production of nitric oxide. Of course, you know that, as I mentioned earlier, drugs like Viagra and Cialis, they work by increasing nitric oxide. Studies have revealed that red ginseng is at least twice as effective compared to a placebo at improving erectile dysfunction. However, other studies have shown no effect of red ginseng on libido or sexual function, and so it's kind of up in the air. Not the erectile dysfunction, the ginseng. Red ginseng, red ginseng is generally well tolerated, but it can cause side effects such as headaches and upset stomach. It may also interact with medications like blood thinners. So if you're taking a blood thinner like warfarin or Coumadin, got to be careful. You can wind up with a hemorrhage if you take too much ginseng. Probably the most interesting herb related to testosterone is this stuff called fenugreek. Fenugreek is, I would say, of all the herbal products that are assumed to increase testosterone, fenugreek is the one that's most popular. It's included in many so-called testosterone boosting supplements. It's said to enhance libido and sexual function. It does contain compounds that your body uses to produce sex hormones, such as estrogen and testosterone. Again, like these stuff like saponins and stuff like that. But it does increase. It also definitely increases as estrogen levels, which may not be desirable for some. One study showed that ingesting a supplement containing Chinese bush clover and fenugreek did raise testosterone levels. But there was a combination of two herbs. It wasn't the fenugreek alone. However, a 6-week study of 30 men found that supplementing with 600 milligrams of fenugreek extract daily as testosterone increased strength and improved sexual function. Similarly, an 8-week study in 80 women with low libido determined that taking 600 milligrams of fenugreek daily significantly improved sexual arousal and desire compared with the placebo group. The supplement raised both testosterone and estrogen in the women who were between 20 and 49 years of age. The truth is, though, that there's very few studies that have examined fenugreek and libido. The studies that showed an increased testosterone are kind of sketchy. I wrote in my Applied Metabolics newsletter when I did an article on herbs that increase testosterone. I gave fenugreek a possibility factor. In other words, it might possibly help increase testosterone, but there's really not a lot of solid research showing that. And as I said, it might also increase libido, but again, not a lot of human research showing that. And also, fenugreek also interacts with blood thinning medications, so you have to be careful if you're taking a blood thinner. Again, warfarin, Coumadin, heparin, something like that. I don't know why you'd be taking heparin. It's usually given by injection. However, interesting thing, just a side note, heparin is a drug. It dissolves blood clots produced in the body. They just came out with a study showing that heparin, if you give it early to somebody with COVID-19, it'll prevent the major side effects associated with COVID-19. Especially related to blood clotting. So that's an interesting fact. Another herb that's said to increase sexual drive is called saffron. Saffron it's a spice derived from the Crocus sativus flower. It has no number of traditional uses. It's said to reduce stress. It can said to act as an aphrodisiac. especially for people taking antidepressants. See, one of the major side effects of antidepressant drugs is that it can decrease sexual drive, libido, can even cause sexual dysfunction in men. Uh, it only happens in a certain percentage of people that take antidepressants. But when this side effect of antidepressants first came out, doctors were told not to tell their male patients about this effect of antidepressants on drugs. I mean, antidepressants on sexual function, because if you put the thought in the patient's head, the patient would wind up getting it. Getting low libido, sexual dysfunction. So most doctors never tell their patients about this. But saffron apparently can help treat the sexual dysfunction brought on by antidepressants. For example, a 4-week study of 38 women with a low libido on antidepressants found that taking 30 milligrams of saffron significantly improved several sexual issues, such as decreased arousal and lubrication compared to a placebo. Similarly, in a 4-week study of 36 men who struggled with desire and arousal related to antidepressant use, taking 30 milligrams of saffron daily significantly improved erectile function compared to taking a placebo. A review of 5 studies of 173 people noted that saffron significantly improved various aspects of sexual pleasure, desire, and arousal in men and women. To sum up, saffron could be of use if you're taking antidepressant drugs and are experiencing a drop in sexual desire. You should definitely look into saffron. It's safe, and as I said, it has a couple of other beneficial effects. If you're not taking antidepressants, using saffron is, I wouldn't bother with it unless you're taking antidepressants. An amino acid that's popular in bodybuilding as a supplement, L-citrulline. L-citrulline is it's not used in protein synthesis. However, it does stimulate mTOR, which is the pivotal compound involved in muscle protein synthesis. However, the main use of citrulline is because it's an alternative to arginine as a precursor for nitric oxide synthesis. The problem with arginine is that 45% of an oral dose is rapidly degraded in the gut by the enzyme arginase. However, when you ingest citrulline, it bypasses that and it travels to the kidney, and the kidney converts it back into arginine. The arginine enters the blood, and as soon as the arginine encounters the nitric oxide synthase enzyme in the endothelium or lining of blood vessels, the arginine is converted into nitric oxide. So, because of the fact that citrulline is converted into nitric oxide, it has some use as a treatment for possible erectile dysfunction, and also maybe even help a little bit with the sexual desire. There's been some recent studies showing that if you combine either arginine or citrulline with erectile dysfunction drugs like Viagra or Cialis, you get a much better effect than taking the drugs alone. It actually increases the effectiveness of the drugs. A small month-long study of 24 men with mild erectile dysfunction found that taking 1.5 grams of L-citrulline daily significantly improved symptoms in half of the patients. In another 30-day study in men, taking the daily combination of 800 milligrams of L-citrulline and 300 milligrams of resveratrol improved erectile dysfunction and hardness compared with the placebo treatment. As I said, citrulline is available as a dietary supplement in capsule powder form. It's also present in foods, mainly in watermelon, and a little bits in dark chocolate, some of it's in nuts. Honorable mention, there's other foods that have a reputation for, stimulating sexual desire, but they don't really work. Stuff like nuts, chocolate, coffee, they don't really work. They're mentioned sometimes, but they don't really work. There's one interesting one called horny goat weed. Now, just the name alone implies that it's going to have some effect on sexual function. And it does. If you're a goat, it's great for horny goats. It makes goats horny. For humans, not so much evidence. It contains compounds that may affect the blood flow to the penis and has been linked to improved erectile function in animal studies. However, you need more human research. And again, horny goat weed has been mentioned as a testosterone booster. It is not. It doesn't boost testosterone. So those are some of the interesting foods that might increase sexual desire. I'm sure that some of these foods will probably work for just about everybody. It's hard to say which food's going to work The best thing to do is if you want to try it and see if it helps you. The good thing about these things is they have no side effects. They can't hurt you. They can only help. So that's about it. If you want to have more information on nutrition, exercise science, hormonal therapy, fat loss techniques that really work, anti-aging research you can use today, ergogenic aids, women's health and fitness, and much more. Subscribe today to my Applied Metabolics newsletter, www.appliedmetabolics.com. 40 to 50 pages every month, no ads, no BS, just solid evidence-based information, including my nearly 60 years of constant study and empirical experience, meaning I've been in the trenches, I've trained in the gyms. I'm not an armchair philosopher. I know what works, I know what doesn't work. I've trained with some of the preeminent bodybuilders over the years, some of the most famous bodybuilders you know. I include a lot of information about the training techniques in my Applied Metabolics newsletters to help you avoid making some of the mistakes I made, which kind of deterred my progress. No matter what your level of education, I promise you, you will learn something by reading my Applied Metabolics newsletter. It comes out on the first of every month, and it's averaging 40 to 50 pages, which means it's about the size of an ebook every month. It's not for these short attention span types who really start to get cross-eyed after reading a paragraph. Not for you. You know, stick with the 5-minute videos. Even this video is too much for those types. What can I say? You know, to each his own. So subscribe today. When you subscribe, I'll send you an invitation to join my private Applied Metabolics Facebook page, where each day I post new information on nutrition, exercise science, general medicine, and health. I also have an email portal on my Applied Metabolics webpage where current subscribers only, I don't take unsolicited questions. You can ask me short questions, which I'll be happy to answer. You're welcome to leave comments and requests for future videos in the comment section under this video. If I think there's enough interest, I'll try and do a video on suggestions, but nothing esoteric, you know, like I don't know, eating horse meat, will it make you grow, that kind of stuff. I'm not gonna do any video. That interests about 3 people in south of France. I'm not gonna do it. Sorry. You know, they're probably not subscribers anyway. If you want to have the best friend you'll ever have, go to your local shelter, adopt a dog. They're the greatest. They're the best. Take care and eat that watermelon.